Hello, good evening. My name is Dr. Baisakhi. I am a specialist OBGYN in Shark Hospital, Fujairah in Northern Emirates. Today I want to talk to you about gynecological problems and laparoscopic surgery. So why I stress the word problems? Because many times we have noticed that females have a lot of issues regarding gynae side. Okay, for example, you may be having an ovarian cyst, you may be having something called endometriosis, which is basically ovarian cyst that is filled with blood. You may not be able to conceive because the tubes are not in the right place. You may be having polycystic ovaries, which is basically the ovaries with small amount of cyst or water filled areas. All these are the problems that a gynae issue can come up. So this can be dealt with medically, and further on we also need surgical intervention. So for women who are having, example, ovarian cyst, single or multiple, endometriotic cyst, infertility issues, and regarding fibroids, which is tumor in the uterus, these are the things that can be done surgical, and these are the things that can be done with minimal invasive surgery, which is basically laparoscopic surgery. Instead of going and doing the old traditional way of open surgery, which causes very trauma to the body, trauma to your healing, the laparoscopic surgery is a better, easier, faster way of doing operation, and it gives you better healing. So you can, with laparoscopy surgery, have a better outcome. So what is laparoscopic surgery? It is basically called minimal invasive surgery, in which a small incision or a small cut is made just near your navel area or the umbilical area, and there are smaller, even smaller cuts made on the sides, and with very thin small instruments the abdomen or the inside your abdominal cavity is visualized or seen, and with that the surgery is done. So this needs a lot of expertise, this needs some amount of time, but it is very safe, and the patient or the person, whoever goes through this surgical procedure, has a very quick recovery. So if you do a surgery in the morning, on the same day evening, sometimes you can be discharged and you can go home. With 1 or 2 days of rest, you can be back to your work. It is not like an open surgery where you need to stay in the hospital 2 to 3 days. Further on, you need another 2 weeks to heal back, and then you need care post-operative. So minimal invasive surgery is the in thing now. You must be hearing it that your friends, your family, somebody else is doing this kind of surgery and they got a good response. Personally, patients who are trying to conceive, they come to us with diagnosis like fibroid uterus, that is a tumor in the uterus or the womb. And these kind of patients, if you do open surgery, no doubt the surgery will be done, but the healing is very, very, very long. And again, further on, because of the nature of the disease, it may again reoccur. The safer way would be to go with a minimal invasive surgery. In this way, even if it is a repeat surgery, the amount of adhesions or amount of trauma that the abdomen has inside your abdomen is less. So the healing is much better. Having said this, I would like to reassure you that in Al Sharq Hospital, we are doing laparoscopic surgery for the gynae cases with a very good team of experienced doctors who have been trained well, and the outcome of the patients is quite good. Just I want to inform you that in case you do have gynae problems, do come to us. Sometimes when we need intervention, we can go ahead and do this kind of intervention with a minimal invasive surgery. So coming back to the natures of the gynae problem that can be surgically helped with minimal invasive surgery are ovarian cyst, which could be a simple cyst, it could be endometriotic cyst, it could be adhesions or small flimsy connections which can happen in the abdomen, for which you can with minimal invasive surgery correct it. Even tumors of the uterus, fibroids, can be corrected. In case you are suffering from infertility, in which the tubes blockage has been going on, or the tubes are damaged, the best way to see this would be through a diagnostic laparoscopy. That means we enter the abdomen, we see the space, and we like to see how is the uterus or the womb, how are the tubes, and how are the ovaries. This way we get a first-hand view of what's happening inside. And if there is any need be, for example, we need to test the tubes, their patency, or are they open or not, in the same sitting we can go ahead and do a dye test, by which a single small thin tube is put from the mouth of the womb and the dye is pushed from down, and through the laparoscope we can see from above, and we can see whether the dye is spilling out from both the tubes. And in the same sitting, for these cases where they are not conceiving, we can even sometimes for the ovaries do ovarian drilling, or sometimes in cases of polycystic ovaries where the tubes are not working, or the tubes are closed, or we don't know the status of the tubes, and at the same time the patient is unable to conceive because of polycystic, even after doing long medical treatment, there is a method by which we can do a diagnostic lap or diagnostic laparoscopy, look into the abdominal cavity, do ovarian drilling, that means bursting the cyst with electrocautery or opening up the cyst so that the hormone levels come down. At the same time we can do a tube test. So all this can be done. The patient can get admitted in the morning and leave in the evening. So it's like a day case. In the meantime, for those cases where the ovarian cyst is large, and when you do an open surgery you have to give a very big cut to the belly, and this doesn't look very pleasant post-operative, plus the recovery of the patient is slow. In those cases we would suggest to go for the laparoscopic minimal invasive surgery, where with the minimum intervention we can drain out the cystic fluid, the cyst then collapses, and then we can take it out to a very small hole. So instead of cutting the belly big, with small minor cuts under the navel area or the umbilicus and 2 or 3 small cuts on the sides, the minimal invasive surgery can be done and the patient can be discharged on the same day. So these are the advantages of minimal invasive surgery. Regarding fibroid or tumor of the uterus, we have noticed that when it is multiple fibroids, or even if it's a large fibroid, either way the healing is better with minimal invasive surgery. So for women who are unable to conceive because they have multiple fibroids, or because their quality of life is not good because of bleeding, the periods are heavy, we can think about removing the fibroids with laparoscopy. Sometimes if a woman age is above 40-45 and she has multiple fibroid, she chooses that I don't want further on to keep this uterus, I need to remove the uterus. This fibroid with the uterus, with the tubes and the ovaries can also be removed laparoscopically. So sometimes when the age is much and the patient is having problem and she needs to remove the uterus surgically, this can be done very safely by the minimal invasive surgery. Now you will ask me, what are the complications? Because what I am telling you is the positive side. What are the negative sides? As like any other surgical procedure, every procedure has its complications. In this case too, there are complications, but these are of a minor level. For example, while we are using the instruments inside and while we are trying to enter the abdomen or the abdominal cavity, it may so happen especially in those cases where they have had past surgeries in that same area. It may so happen while we are entering, because it's a blind procedure, sometimes if the surgical area is obliterated, we may have a risk of entering into the wrong pathway. But then again, because our team is very experienced and our team has good surgical background, so most of the time we avoid that area of the surgery and we go to a clean area where there is no cut and there is no fibrosis from previous surgery, and in this way we give the patient a very good outcome. The other side effects can be, as like any other general surgery, minor amount of discomfort, some amount of scanty bleeding, and some amount of infection can happen, but because of that we take care, we give you antibiotics, we give you painkillers, so as that your recovery is faster. That is why nowadays many patients choose to go for minimal invasive surgery rather than going the traditional open surgery. As medicine is moving ahead, with every 10 years we get to see new development. So for the last 20 years laparoscopy has been slowly building up, and now the new trend is to go for laparoscopic surgery, because everybody wants quick recovery, less intervening of surgical trauma, and better outcome. So in our times when we were studying, laparoscopic surgery was still in its very early stage, but in the last 20 years laparoscopic surgery, the instruments, the technique, the way that it is done, the training, everything has improved so much that it is now very safe. In fact, I would recommend, if you are planning to do any of these surgeries like diagnostic laparoscopy to know how is the ovaries and the tubes, or ovarian cystectomy to remove the ovarian cyst, or to remove endometriotic cyst. If there is severe pain in the abdomen because of previous surgeries, you may have adhesions or fibrosis inside the belly. So by laparoscopy we can remove those fibrotic bands and give relief to your chronic pain. You may even have fibroid tumors which can be removed with the help of laparoscopy, and there are multiple ways in which people are already using laparoscopy. You must be familiar with laparoscopic gallbladder removal and laparoscopic appendectomy. This is quite common in general surgery. For the OB/GYN point of view, I would stress that in future this laparoscopic surgery is coming up in a big way. So in future patient would be opting out to go for the laparoscopic minimal invasive surgery, and this gives better healing, better recovery, and it is safe. So the only thing I would like to stress over and over again, that whenever you do need a laparoscopic intervention, whenever you do need a surgical intervention, whenever you think that my situation or my medical condition needs a surgical treatment and is not getting any better with medical treatment, then I would advise you to opt for minimal invasive surgery. The reason why I am having this discussion today with you is because in Shark Hospital we have been doing laparoscopic surgery for a long time, but many people are not yet familiar that we are also doing, for the gynecological side of the problems, we are also doing laparoscopic surgery, as I explained to you, like fibroid removal, like ovarian cyst removal, for example for infertility, and these are the things that are basic. Sometimes for chronic pain we are doing adhesiolisis, okay. Sometimes even for infertility cases we are doing ovarian drilling, diagnostic laparoscopy, lab dye test. So these are the things that a patient can think about, or you can think about, and you know nowadays everything is available in Google, so you can Google the information, you can come prepared with the information, so that whenever you are opting for any surgical intervention, if there is no medical treatment or the medical treatment has exhausted itself and you need a surgical intervention, I would advise you to go for laparoscopic intervention. So today this was the reason why I wanted to explain to you the gynae problems and how laparoscopically you can solve it. If you are comfortable with this new form and this new idea that I am telling you, please look it up. Come to us. We are here to help you. We are here to discuss with you, and we are here to go ahead for minimal invasive surgery that we can do in Al-Sharq Hospital with a very good team of laparoscopic doctors who are well trained. So think about it. We would like to invite you to come and talk to us, discuss with us, and get an idea of how you can heal better and faster from a gynecological problem. I hope that this talk that I had with you will give you some information and will give you some idea of how to go ahead, and will help you to make a decision so that you will go forward with minimal invasive surgery in our hospital. As you are familiar with the Al-Sharq Hospital, we've been here and giving good services in Northern Emirates. So please, you're always welcome. Come forward, talk to us. We are here to help you, advise you, guide you. Thank you so much and have a nice day.